Mr. Shadegg.
Mr. Chairman, I'll be brief, but I simply want to raise the issue that I think Mr. Barton just raised, which is what authority there is to do away with plans and whether the Commissioner has the authority to do so. I believe at page 16, beginning with line 20, grace period for current employment-based health plans, the bill, by its language, says that a plan can exist, a current plan, a health care plan for employer-provided health care may continue to exist for 5 years without meeting the requirements, the minimum requirements prescribed by the Health Care Benefits Advisory Committee for that 5-year period. At the end of that 5-year period, if it does not meet those requirements, it goes away. So as I understand it, the Commissioner does have the authority to wipe out all existing plans at that point in time. And I believe that's what Mr. Barton was referring to. It's not something we need to go into now. We can go into it at a later point. Indeed, I'd be happy to ask for a clarification from counsel at a later point in time. With that, I'll be happy to yield to Mr. Rogers of Michigan.
Thank you. And Mr. Shadegg and I think others, you point to the huge problem of dropping a 1,200-page bill where I think nobody's read the bill clearly. And maybe, Mr. Chairman, you haven't got to page 44. Under Section B of that page, suspension of enrollment of individuals under such plan after the date of Commissioner notifies the entity of determination. So not only can you do a whole plan, which is in a later section in the bill, under this page, they can actually go to an individual and throw you off a plan. So it is clearly under the bill of which you have written that they can throw people off the plan, and you've given not only the Secretary, but this new Health Choices Commissioner. And that's what I think is so dangerous. And if you're concerned that they can do that, Mr. Chairman, it sounded like you were, maybe we ought to postpone this hearing and actually allow us to go through this bill and find those instances where you have empowered the federal government to throw individuals off their bill. And by the way, there's nothing in here that even says you have to notify them. It's pretty dangerous stuff. And I'm going to agree with Chairman Waxman that this is a concern, and we ought to work together to get it out.
Will the gentleman yield? Will the gentleman yield?
It's my time, and I'd be happy to yield to the gentleman from Oregon.
I just want to follow up and maybe enter into a colloquy with my colleague from Michigan, because are you saying that this unelected commissioner can do something to throw people out of their insurance plans without notification, perhaps? Is that what you were saying?
Under the bill that is written and has been presented to us yesterday, that is exactly what they can do. The suspension of enrollment of individuals under any plan after the date the commissioner notifies the entity, they can do it.
So they can do that, and the amendment before us simply says if they're duplicative grant programs, that the Secretary should try and eliminate that duplication, right?
That would be correct, sir.
But we're hearing that shouldn't be allowed. That's too much of a delegation of authority. But yet in the bill they can kick people off a plan without. I mean,
and not only do they kick them off the plan, sir, but under the second paragraph down, they can also suspend payment to the entity under health insurance without notification.
Gentlemen, yield to me. Mr. Shadegg.
I'd be happy to yield to the chairman.
I think that what's being raised is a red herring, and let me tell you why. We allow the Commission to look at the insurance plans to be sure that they meet the requirements under the law that this bill would promote. For example, if an insurance plan were discriminating against people based on pre-existing condition, and they refuse to make a change in that plan would not be qualified to be operated. That is the power that's given, not to say to individuals that they can no longer get insurance. No one would be for that. But we're not talking about that section of the bill. We're talking about a different section of the bill.
The chairman has pretty much unlimited time, reclaiming what limited time I have left, and having in the past been criticized for consuming all of the time I'm given. Let me simply just say that I appreciate the gentleman's explanation, but that does not appear to be the words of the bill. The words of the bill seem to indicate that plans must go out of existence by a ruling of the commissioner at a certain point in time, and that seems to be in the commissioner's discretion. And the language raised by Mr. Rogers makes it pretty clear, at least from the wording of the bill. And all we can do, Mr. Chairman, given the circumstances of not having been in the process of drafting this bill, is to read from the bill. And I think the gentleman from Michigan has adequately pointed out that this allows the suspension of the enrollment of an individual under such plan. That's the wording of page 44, line 16 and 17. And I'd be happy to yield to Mr. Rogers.
Thank you, Mr. Chairman. But and not only is it